Member for Wollondilly.
Thank you, Speaker. My question is to the Minister for Health. Minister, I've lodged a notice of motion to Parliament to recognise the global and national bidding war taking place for medical practitioners across many fields. Will the Minister outline what his department and office are doing to stop this trend, and will the Minister commit to work with me to reverse the trend of health workers leaving the system?
I call the Minister.
Thank you, Mr Speaker, and thank you to the member for Wollondilly for that question, a member who was in a previous life an optometrist, a member who has spoken to me about expanding the scope of practice of our optometrists and making sure that they can use the full skill set and knowledge that they have. Mr Speaker, this is an important issue. We do have a global challenge when it comes to medical practitioners and graduates right across the board. 2 years ago, when I was appointed as the Health Minister, one of the first people I spoke to obviously was the Federal Health Minister, and after I asked for more money, my second question was around the challenges of workforce, and particularly the challenges of workforce in regional, rural and remote areas. Mr Speaker, as elected health ministers across the country, we had established the Health Workforce Task Force. It's been chaired by Susan Pearce, the Secretary for New South Wales Health. A review was conducted by a former Secretary for New South Wales Health that many people in this chamber will know, Mr Speaker, and that's Robin Kruk. The Kruk review, as it was known, was all about what we could do as legislators to try and fast-track and reduce the red tape and time taken to get suitably qualified medical practitioners from other countries registered and into practice in our country. Now, this is particularly important, as I said, Mr Speaker, for regional, rural and remote areas. So people like the member for Barwon and our other member for Murray and our other significantly regional and rural and remote MPs understand the importance of getting these graduates and getting these staff into the labour force within their local health services. So what specifically we have done is to try, Mr Speaker, in work with those regulatory agencies, including AHPRA, that essentially regulates health practitioners across the country, to try and make sure that we can fast-track those people who are suitably qualified overseas and want to come and work in Australia and, from my perspective, in New South Wales. Now, this is a challenge. We've got to make sure that the skills are comparable, the knowledge is comparable, the way in which health services are delivered, to be honest, is comparable. So if you think about it, often it is countries and areas like Great Britain, parts of Europe, Canada, New Zealand, typically have a health system that is not too dissimilar to ours. Ours is better, but theirs is not too dissimilar to what we have got here in New South Wales.
Yes. Member for Wollondilly. Yes, an additional 2 minutes is granted.
Thank you, Mr Speaker. Coming out of that Kruk review and working with AHPRA and the other regulatory agencies, as well as regulatory agencies within New South Wales and other jurisdictions, we've been able to fast-track a process for GPs, obstetricians, gynecologists, a range of different psychiatrists, a range of different specialties that we need to get more of in New South Wales. Now, we are going to continue to work on this as a ministerial group. Obviously, we now wait the outcome of the upcoming federal election to see who's appointed as the Federal Health Minister going forward. But Minister Butler has been a terrific partner in this process, and I want to acknowledge his work. I also want to acknowledge my state and territory colleagues who have engaged with this, as well as AHPRA. This is not an easy issue to deal with because, Mr Speaker, what we have in New South Wales is a complex health system, but a very safe one, conservative in nature in terms of the fact that we put safety first, second and third, and we have to, and that means we need to be very careful in making sure that people qualified overseas can similarly do that work here in New South Wales. So we'll continue to look at other specialties. We'll continue to look at other ways we can do it. I welcome I welcome this question from the member for Wollondilly. I know that healthcare for her community is one of her key priorities, and of course I am willing to work with her, engage with her on and as a part of the work that we as state and territory health ministers are doing in conjunction with the Commonwealth, led by Secretary Susan Pearce, on that important work of the Health Workforce Task Force.